question that arises in the mind of the students is as to what to study and how to study. Now, how to study and what to study, you should basically know what the pattern of the exam, what are the things they'll be asking in the exam. Okay, so what is being proposed is 60% of the questions that will appear in the exam will be problem solving questions. Okay, 30% of the questions that will appear in the exam will check your comprehension and analytical skills. 10% of the questions that will appear in the exam will be basically recall based questions. Okay, now out of these questions, what is being proposed is 10% of the questions will be from applied basic sciences, that is anatomy, physiology, biochemistry, etc. And 10% of the questions will be from preventive and social medicine. Okay, so what is the proposal is you should have a problem based approach. So basically they want to check your clinical skills. Now your clinical skills basically develop in the IPD. So you need to attend more and more clinics, see more and more patients. Okay, try to diagnose more and more cases and try to see what treatment is going on. Okay, and try to learn what will be the differentials for the same patient, right? So this is what they are basically trying to see. I'll be giving you a few examples as to what the question pattern might be here. Okay, previously the questions that were being asked in the PG entrance exams were basically recall based questions. Now I'll give you an example. Previously the questions were like nerve involved in Erb's paralysis. Okay, options C3, C4, C5 and C6. Now as we all know, the most common involved nerve in Erb's paralysis is C5. Okay, C6 is less commonly involved, so the answer here would be C5. Now with the change in the pattern, the question would be like a 30-year-old male presented to you with history of fall on shoulder, okay, with his arms adducted and medially rotated, his forearms pronated and extended position. Okay, so what is the probable diagnosis? Options are Klumpke's paralysis, second is Erb's paralysis, third is injury to lateral cord, fourth is injury to serratus anterior. Okay, this might be the question that might, which this is basically a question which will check your problem solving skill. Okay, now coming with history of fall on shoulder with arms adducted, medially rotated, with forearm pronated and extended is nothing but a policeman's, this is what known as, my friends, policeman's tip hand deformity, right? So this is usually seen in Erb's paralysis. So you need to know that the arms are adducted, medially rotated with pronated and extended forearm is nothing but seen in Erb's paralysis. Now they might go a step further and they might ask you, is 30 years male coming to you with history of fall on shoulder with the following deformity, that is arms adducted, medially rotated, forearm pronated and extended, which of the following nerve is involved in these cases? So for this you need to know that this, the above question is about Erb's paralysis. Now since it is about Erb's paralysis, we know the most commonly involved nerve in Erb's paralysis is C5, okay, and less commonly C6, so the answer here will be again C5. So this is how they check your problem based solving and analytical skills. Okay, this is one example. The above example which we saw about herbs paralysis describes basically how the applied sciences come into clinical practice. Okay, now I'll give you another example. A 50-year-old male, after winning a lottery, had a party at his home in which he drank 450 ml of alcohol. Okay, after few hours he presented to you with palpitation and a BP of 95/50. Now what is your probable diagnosis? The options given are atrial flutter, next is paroxysmal atrial fibrillation, next is sick sinus syndrome, and then we have what is known as the ventricular tachycardia. Okay, so these are the four options. Now a 50-year-old male coming after a consumption of alcohol with history of palpitation with fall in the BP. If you remember, there is something called as alcohol holiday syndrome. So which is basically seen in atrial fibrillation. So this is probably a case of paroxysmal atrial fibrillation. Okay. Now I'll give you another example so that you understand how the problem solving questions appear. Suppose there is a 30-year-old female who presented to you with anemia. Okay, that is not resolving with iron therapy. Now the last iron therapy was given 3 months back. Still the patient is not improving. You see her CBC profile. It is shows hemoglobin 9 gram per deciliter. Okay, the MCV 69 which is low, MCH is 22 which is again low. Okay, the WBC count here is normal. Okay, the serum iron levels are normal. Next, serum ferritin levels are high. Okay, the total iron binding capacity is normal. Hemoglobin electrophoresis is also done, which appears to be normal. Now, what is the differential diagnosis? Okay, sorry, what is your probable diagnosis? Whether it is iron deficiency anemia. Second is anemia of chronic disease. Okay, I forgot here CBC profile ESR is also normal. Third, whether it is sideroblastic anemia or whether it is put beta thalassemia trait. Now this question will check your analytical skills as well as your problem solving capacity. Now we know this is hemoglobin 9 which is anemia for sure. Now we see the MCV and MCH, okay, both are low. So this indicates that it is what? Microcytic hypochromic type of anemia, right? Okay, so we know that microcytic hypochromic anemia is seen in iron deficiency anemia, it is seen in sideroblastic anemia, it is seen in beta thalassemia trait. Now we need to rule out one by one. Now why it is not any, okay, now since iron levels are normal, ferritin is high, total iron binding capacity is normal, so it is not iron deficiency anemia. Okay, now the serum ferritin is high, it can be high in anemia of chronic disease, but most commonly in anemia of chronic disease the picture is normocytic normochromic type of anemia, right? Okay, another thing in anemia of chronic disease, there are signs of inflammation and the ESR is rarely normal. So this can't be anemia of chronic disease as well. Okay, another thing is we remain with two conditions, beta thalassemia trait or sideroblastic anemia. Now, if you see, there is hemoglobin electrophoresis done, where hemoglobin electrophoresis is basically normal, means beta thalassemia trait is ruled out. Okay, so the answer here is sideroblastic anemia. Okay, so these are basically what kind of questions can appear in your next exam. So you need to start preparing and updating yourself for this exam. We will surely try and bring to you more exam. Do subscribe to our YouTube channel for such latest update. Also, don't forget to click the notification bell. Thank you, my friends. Finally, keep yourself updated. Do write to us in the comment section if you want more about the MCQs which might appear into the next exam. We will be there to guide you. Do subscribe for our latest updates at Doctors for Doctors channel. Thank you.